Hello guys and welcome to another video of KEA tutorials. Our topic of discussion today is a gastrointestinal disorder, the dumping syndrome. Dumping syndrome is a condition that occurs when undigested food moves very quickly from the stomach to the duodenum, the first part of the small bowel. It is also referred to as rapid gastric emptying. Dumping syndrome is of two major types. Based on the timing of symptoms, we have early dumping syndrome. In this case, symptoms occur within 10 to 30 minutes following a meal, and late dumping syndrome, case in which symptoms occur 2 to 3 hours after ingestion of the meal. Early dumping syndrome occurs when a large quantity of hyperosmolar food like food containing high amounts of sugar suddenly enters the small bowel. The increased osmolarity of the food particles causes water to move rapidly into the lumen of the small intestine, causing its distension. Late dumping syndrome occurs when food containing large amounts of sugar is rapidly absorbed by the small intestine, leading to a sudden spike in blood glucose levels, and release of insulin from the pancreas in response to the elevated blood glucose. The effects of insulin are responsible for the symptoms of late dumping syndrome. Talking about the causes of this condition, surgery on either the stomach or esophagus can lead to it. Because this reduces the capacity of the stomach to store and digest its content, which leads to rapid emptying of the stomach. Examples of procedures on the stomach that may lead to this are fundoplication, where the fundus of the stomach is wrapped around the lower end of the food pipe, and stitched in place. Gastric bypass, where a created stomach pouch is directly attached to the jejunum, bypassing the initial portion of the small intestine. And lastly, gastrectomy, which is partial or complete removal of the stomach. The signs and symptoms of this condition depends on how early or late the symptoms manifest themselves. In early dumping, the symptoms manifest with 20 to 30 minutes, while in late dumping, they manifest within 2 to 3 hours as discussed earlier. For early dumping, we have nausea, vomiting, diarrhea, cramping or abdominal pain, dizziness, irregular heartbeat and flushed face or skin. For late dumping, which occurs with 2 to 3 hours with the main concern being hypoglycemia due to insulin, we have signs and symptoms like feeling hungry, weakness, confusion, agitation, fainting, and sweating. Note that these signs and symptoms guide your medical diagnosis in differentiating between the types. In order to achieve an accurate diagnosis, some methods will need to be employed. We have 1. History and examination. The doctor notes down the symptoms following a detailed history. A scoring system is employed, assigning points to each symptom. A score of above 7 increases the likelihood of dumping syndrome. The following tests may be employed to confirm the diagnosis, and to distinguish from conditions that present with a similar picture. 2. Modified oral glucose tolerance test, where following overnight fast, the patient is given a solution containing glucose to drink. The person's blood is drawn before the administration of glucose to check the baseline values, and compared with the measurements after the test. Blood is drawn at 30-minute intervals after drinking glucose till 180 minutes. The parameters measured include blood glucose levels, hematocrit, blood pressure. 3. Gastric emptying scintigraphy test. The person is given a bland meal containing a small quantity of radioactive material. Images are taken at 1, 2, 3 and 4 hours to measure the rate of gastric emptying, while a camera scans the abdomen to locate the position of the radioactive material. Talking about treatment, our interventions have for aim 3 targets: lifestyle and dietary changes, medical approach, and the surgical approach. Talking of lifestyle and dietary changes, we have taking 5 or 6 small meals per day instead of 3 larger meals. Postponing liquid intake until at least 30 minutes following a meal. Intake of more protein, fiber, and complex carbohydrates and avoiding simple sugars. Increasing the thickness of food by adding pectin or guar gum. Lying down after meals for about 30 minutes. Under the medical approach, the drug most often employed to manage symptoms of dumping syndrome is octreotide, Sandostatin. It acts by delaying gastric emptying and preventing the secretion of insulin and other GI hormones. It is administered as an injection, either multiple times a day or once a month, depending on the formulation. If conservative approaches don't help, surgery may be recommended. Depending on your situation, surgical procedures to treat dumping syndrome may include reconstructing the pylorus, or surgery to reverse gastric bypass surgery. To prevent this condition, some measure can be envisageable. Avoid drinking water or liquids half an hour before and after meals. Avoid foods containing simple sugars, as they rapidly pass from the stomach and are more likely to cause diarrhea and cramping. Examples of such foods include fruit drinks and juices, soda, cakes, cookies. Avoid milk and milk products if they trigger dumping symptoms. And it may be well to limit or avoid gastric stimulants such as caffeine, tea and alcohol. Include complex sugar-containing foods such as rice, potatoes, pastas, bagels, breads. Include foods that contain high amounts of soluble fiber, such as apples, pears, beets, spinach, oats and Brussels sprouts. These slow stomach emptying and prevent sugar from being absorbed too quickly. Include foods rich in protein in the diet, such as eggs, fish, milk, cheese, yogurt, peanuts and peanut butter. A small quantity of fat may be included in the diet, as fat delays emptying of stomach. Examples include butter, margarine, mayonnaise. And ensure that you get adequate amounts of calcium and vitamin D from diet and supplements. Thanks for watching. Don't forget to subscribe to our channel, like and hit the notification icon for YouTube to remind you of our updates. See you in another video.